If you're someone with chronic illness or chronic pain, due to a traumatic event, and you're tired of symptoms being minimized, brushed over, or even completely ignored by your medical professionals, psychiatrists, doctors, nurses, any of that sort of thing, then you've got to start with advocating. And listen, I know advocating for yourself is hard. We tend to trust doctors, so we don't want to contradict them, and we don't want to think that they're wrong. We go to them, we want them to guide us. And in so many ways, we feel dependent and sometimes can't even tell when they're giving us bad advice. So it can feel really hard to know when or how to advocate for yourself. But advocating for yourself is a skill that you can and should learn for yourself if you are someone that has chronic mental illness or chronic illness and pain. So I'm going to teach you how. All right. So the first step, there's 4 steps that are super easy to remember. The first step is you need to come prepared to save time in the process, right? When you come prepared, you're going to save time. So meaning create a list outside of your session, create a list of all your symptoms, all the remedies you've tried, all the medicines, think about any supplements that you've taken, think about any, if you've done any PT or anything like that, right? Therapies, all the different types of things that you've tried, and put it into a timeline, right? So if you've been having symptoms for 3 years, started at the 3-year mark, and then try to, as good as you can, it doesn't have to be perfect, but go ahead and put in broad strokes of what has happened, when the symptoms started, what happened, what you do, when, and did it work, right? And I like to, put arrows down or arrows up to show, did my symptoms go down or my symptoms go up, that sort of thing. When you go in prepared like that, man, it makes doctors so much, like you're so much more able to just share what you need to in a short amount of time. Because listen, with managed care, we don't have a lot of time now to talk to our doctors like we used to back in the day. So 1, come prepared. Number 2 is you really want to select your providers wisely. Not all doctors are the same. And a big rule of thumb that I use is to use word of mouth referrals. We have a big referral list with providers that our clients have come in saying good things about. And we take that very seriously because not all providers are trauma informed. Not all of them will take that time to listen to you. And some of them, quite frankly, just have bad bedside table manners, and they can be wounding to you, especially if you have a trauma history. It can really reinforce all the negative things that have happened to you in the past, and we don't want that. That's not helpful for your health. So 1, be prepared. 2, look for providers that listen and care about your experience. 3, consider looking for a functional or an integrative medicine doctor who would look at the whole picture, like a broader section of your symptoms, and kind of think outside the box. And the 4th thing that is so important is schedule in time. It takes time to make phone calls, to do the research, to recover from failed attempts and frustrations along the way. Give yourself the margin for that and keep going so that you can have the persistence to get your needs met. Thanks so much.